Well, let me say hello to everybody. Good evening.
Good
My,
evening.
my name is James McJunkin. I'm the executive minister, executive pastor of the Philadelphia Baptist Association, and we're delighted that you all have come and joined us tonight for an important conversation about COVID-19. Our purpose is to look at a role as people of faith and advocacy with this continuing pandemic. How is it that we can both be helpful to make a difference in the lives of our communities, and also what do we need to be saying to our civic leaders to encourage kinds of outcomes that we would like to see. The federal, the United States makes up about 4.4% of the world's population. And right now we're making up about 30% of the new cases in the world today. We've experienced or we've suffered 138,000 deaths in the United States. And we have over 3,500,000 cases in the United States. To most of the medical professionals and public health experts that I've heard, the federal plan is characterized by dysfunction, disinformation, distraction, denial, and delay. Our ears continue to ring with themes of unavailability of testing, long waiting times for results, inadequate levels of testing, contact tracing, and quarantine strategies to tamp down the virus. We're hearing again that shortages of personal protection equipment and ventilators are continuing. We're hearing now the stories again of exhausted medical staff. It's kind of like what we heard when in New York a few weeks back. We're starting to hear all over again down across the South and out West. We're also concerned about the disproportionate impact on communities of color, safety issues, etc. So tonight we have as our guest Senator Vincent Hughes, who's going to start us off, and we'll be joined by Commissioner Thomas Farley, Health Commissioner for the City of Philadelphia. They're going to share with us, you know, in the middle of all of this, in the midst of all of this, exactly what's going on with the state, whether there are plans, whether they're doing, what should we expect, what should we know about, and then we'll learn the same things about what's going on in the city. I understand that there were 100 people who registered for the event. We're very happy to see you. And Dr. Farley will be here in just a while. He's coming in from another call, and we'll be continuing to work across the evening. He will be going to another setting after he leaves us. So we're delighted for the support. I want to thank Luis Cortez of Esperanza, Reverend Cortez, Mayor Good, Wilson Good, and Vincent Hughes and the staff, particularly the staff for their patience as we worked hard to make all the arrangements and to get this to happen. So I wanted to up front, before we get started, make sure that I expressed a deep appreciation. And in fact, I was invited to be a part of a conversation with Senator Vincent Hughes. And he mentioned the fact that there was advocacy that needs to be done by congregations, and that we needed to be talking with the commissioner about things that were going on in Philadelphia. And so I took him up on his comment and said, okay, let's follow up on it. Let's see if we can make it happen. And it took a while to pull all the pieces together. And praise God, we are here. So the majority of our folks are from the Philadelphia Baptist Association, Hispanic Clergy of Philadelphia. I see Ruben Ortiz here, and we appreciate your support in getting the word out. Mayor Good sent out invitations across his network as well as Senator Hughes. So let's open with the word of prayer, and then we will go to Senator Hughes. I'll pray. Gracious God, we thank you for this day, for this nation. We pray for our nation and all of our elected officials. We pray that what's done today would be pleasing and help us to move in a direction that saves lives, that makes us whole. In Jesus' name we pray. Amen. Senator Hughes, you have it.
Thank you, Reverend McJunkin, and thank you, Reverend Dr. Mr. Mayor, always Mr. Mayor Wilson Good, for working with us and staying on my case that we got all pieces in place to get this gathering together. And I also want to thank Robin Maddox, who works for me, but the truth of the matter is I probably wind up working for her.
Hey.
Hey. See, there you go, interrupting already. Somebody please put her on mute. All right. For just staying the case and staying the course and getting this conversation together. We are obviously, in many respects, compromised with our ability to come together up close and personal. But in some respects, the technology of Zoom has allowed a little bit more, in many ways, some flexibility for us to connect with one another, no matter what the circumstances are. For those, many are on this call, as I look through the phone, see lots of friends. And many of you know that I am a child disciple of Mount Carmel Baptist Church. And I got to call out Ken Woodson's name. He's looking at me right in the face. Mr. Mayor, another one of your disciples right there, Kenneth Woodson. And I want to make sure that I acknowledge my pastor, Donald Moore, and of course, pastor of pastors, Albert Franklin Campbell. Can't go a day without talking about him. But I think the impetus here is to make sure that folks are, from a policy perspective. I'll start in Harrisburg and provide some other observations for city policy and also for federal policy. We need to pay very close attention to what Commissioner Farley is saying, and he will report that in a few minutes. Our health commissioner in Philadelphia, and we also need to pay very close attention to what Dr. Levine is saying from Harrisburg as our health commissioner, and of course, under the direction of Governor Wolf. Pennsylvania has managed COVID and all of its difficulties better than most states, and in fact has been recognized as one of the three top states on how it has managed COVID-19. It was recognized by the Centers for Disease Control. Pennsylvania, Hawaii, and Montana were recognized as three of the principal states who have done the best job in terms of managing COVID-19. Here's the however. As you know, yesterday, Governor Wolf announced certain policies that would put restrictions on a number of our establishments that serve alcohol. And I'm not talking about the beverage that's served on Sunday mornings, okay? That served alcohol, and the need to have to shut them down in a very dramatic fashion almost immediately. Now, if you're a facility serving alcohol and food, you're given some liberties. You can stay open, but if you're just serving alcohol, he's going to have to shut us down. I use that as a vehicle to kind of give context to my comments. Yesterday, the governor and his technical staff briefed me and Democratic and Republican legislative leaders in Harrisburg prior to his public announcement of this decision to shut down a certain specific establishments. And in the course of that conversation, we were introduced to Dr. Rubin from Children's Hospital of Philadelphia. And he runs the CHOP Policy Lab. And I'll send a link to that if you don't already have it, so you can get connected to that data, that science, that technology. And it is the data that's being accumulated there that has been a big informant to Pennsylvania in its decisions. And why? So instead of a broad shutdown, it's more of a surgical shutdown that is occurring in Pennsylvania around certain establishments. Again, establishments that serve alcohol purely. You go into a bar or whatever, and you go to buy alcohol, and you're going to sit in that bar and you drink that alcohol. So what the data is informing us, and I'll connect you to some of that data, I'll put it in the chat, is that the return of the spread, the return of the surge coming back to Pennsylvania is, long story short, seems to be driven through people returning from Florida, returning from Texas, returning from a number of states that we've seen a huge surge in. And one of the principal vehicles that it seems to be coming through is through these particular establishments that are serving alcohol. The technology that they are utilizing is technology through your cellular device. And what they're able to track, and this may be a little bit scarier than what we're talking about right now, but we'll just keep it to COVID-19. They're able to track when a cell phone or a cell device enters a particular location, how long it's staying at that location, and when it leaves that location. Some of you may remember around Memorial Day, where a number of folks were gathering in beaches in Florida, and they were able to track through time when they arrived at the beach in that location and when they left and the communities that they went back to. So in other words, largely going to a place where there's an incredible opportunity for spread, through tracking their cell phones, go back to their home destiny. It's an incredible piece of technology. It's scary in some respects because it's able to track what's happening with these devices. But it gives us a handle on what's happening with this disease. And this is where it's coming back to in Pennsylvania. And it's coming back to Pennsylvania in just about every county across the state of Pennsylvania. All right? So therefore, we need to, and we're going to do our best to connect you to this data. I'm going to try to put it into the chat room, and so you can pull up that link there. We're able to see what's happening, and the governor's decision yesterday is try to shut it down immediately so it doesn't further invade Pennsylvania. Florida had its greatest number of deaths 2 days ago. Today is Thursday, it was on Tuesday. 134 people died in Florida in one day from COVID-19. We don't want this coming back to Pennsylvania. So consequently, the action that was taken. In Pennsylvania, how have we tried to respond in addition to trying to shut down the spread. We tried to respond by dealing with, on the health side, the issues of testing and contact tracing, and ramping up in a dramatic fashion a statewide testing program and a statewide tracing program, contact tracing program. And contact tracing, as I know you all understand this, requires some very delicate conversations with people, because you're literally asking someone, well, where were you yesterday? Who were you with yesterday? And can you help us connect with that person so we can find out where that person was and who that person was with? And if you just let that flow through your brain just a little bit, that can cause for some very delicate conversations as we deal with the issue of contact tracing, so we can make sure that we're getting our arms around this virus. So from a financial standpoint, the federal government awarded the city of Philadelphia, I believe, $92 million to invigorate a testing and contact tracing program. The federal government also awarded the state of Pennsylvania a $301 million grant for testing and contact tracing. Now, this is supposed to last not just for 60 days or 90 days for some. This lasts for, I believe, about a 2-year period, all right? And that's how that money is supposed to be allocated over an extended period of time. We're working to get the state program to be complementary to the city of Philadelphia program. So that's the $92 million received by the city of Philadelphia. The city of Philadelphia is the only community in Pennsylvania that got a direct allotment of funds for testing and contact tracing. The $301 million is supposed to be spent everywhere else across Pennsylvania to establish a strong testing and contact tracing program. So we'll talk a little bit about that more as we go along. As you know, we've also established at the state level a $225 million small micro business grant program to assist small micro businesses, the beauty salon, the barbershop, okay, the neighborhood restaurant, the auto mechanic establishment. And that program opened up on, I believe it was June 30th. The first round has closed on July 15th. We're doing a review of the applications that have come in, but I can tell you thousands and thousands of applications have come in from across Pennsylvania. And hopefully within the next couple of weeks, small business will start receiving checks. But I can also tell you that we're going to need a lot more money to complement or add into that program to try to get financial assistance out and financial grants out to these small businesses. These small businesses, as you know, are the lifeblood of our communities. They make the donations to the Little League, to the basketball team, to whatever in our neighborhoods. And those dollars came from the federal government to Pennsylvania, and we were allowed some discretion to develop a program, and we developed the small business grant program of $225 million. Historically, $100 million of that $225 million is scheduled to go to Black and brown communities. They're called historically disadvantaged businesses, but they're scheduled to go into Black and brown businesses. As you know, and I know, Mayor Good, you've tracked these issues for years, for decades. It's the largest infusion of money into Black and brown businesses in the history of the Commonwealth of Pennsylvania. We execute this correctly. It'll set up the foundation for how we need to try to drive dollars into these small businesses, these small diverse businesses going forward. I'll wrap up some of my initial comments and do my best to answer questions. Reverend Junkin, I need folks to understand this. Philadelphia is in a huge budget deficit. and the state of Pennsylvania is in a budget deficit of well over $4 billion. $4 billion at the state level. That is not a little bit of money. It's a huge budget deficit, and it couldn't come at a worse time. You cannot cut programs at the state level to deal with that kind of budget deficit. And we're in an environment where unemployment rate is soaring. You cannot increase taxes, or it is very difficult to have a conversation to increase taxes to deal with a budget deficit of that nature in this environment where unemployment is so high. Consequently, we really, really, really need the federal government to step up and to continue to provide assistance necessary to help out our school districts, our municipalities, cities, townships, counties, what have you, and of course the state of Pennsylvania to fill these budget holes, to deal with this budget crisis. The city can't print money, the state can't print money, but the federal government can print money, and we need to step up in that. Under Speaker Pelosi's leadership, they have passed a HEROES Act, which is very important, very necessary. We're meeting with Senator Casey on Monday morning to get a status of where that legislation is on the Senate side. If we can get some action out of that and some, hopefully in the next several weeks, month, that we might be able to get some funds from the federal government to come in to relieve some of this pressure off local cities and of course school districts and the state of Pennsylvania. The final urging is to make sure that we do not get comfortable in this new normal. All right, there's a tendency to want to say, well, this is the way the world is going to be, and we just got to adjust with it and deal with it and live with it. The kind of pain that is happening in communities all across the state, all across the nation, is so severe that this cannot be a level of comfort that we adjust ourselves to and just try to figure out we can ride it out. We're used to, the folks on this call are used to being able and standing up and saying, we'll tough it out. We'll deal with it. We'll figure this out. This is not a normal that we need to adjust ourselves to. This is a normal we need to fight against. So consequently, public attention and public engagement is extremely important as we go forward. I could talk about voting. I could talk about what's happening in the electoral system and how we need to make changes there. But I think Reverend Good and Reverend McJunkin, I'll do my best to open for any questions that folks might have and try to be a way to answer them.
The questions that people sent ahead will be asked of you and the health commissioner in a few minutes. I think what we'll do, Maria, I'm going to punt and ask you to ask the questions, some of the questions that came in for Senator Hughes now, and then that way we'll check and see technically what's going on with the health commissioner. Okay.
Not a problem at all. Thank you, Dr. McJunkin, and thank you, Senator Hughes, for sharing with us on this evening, and good evening to all of you for joining us. So, Senator Hughes, we did have a number of questions that were sent in, so I will try my best here to share a couple with you. I'll start off with this one. What steps have been taken to alleviate the apprehension of the vulnerable population in returning to engage in life outside the home, such as going back to schools? And there's a follow-up question related to schools in particular. So I will just kind of open up that for you to begin that discussion.
Timely question. We are meeting with the Education Secretary tomorrow morning at 9 a.m. Secretary Rivera, Pedro Rivera, who kind of sets the policy and sets the tone for our education system and how we engage there. And so we'll be asking those kinds of questions. I think how do I say this? Most of our schools were underfunded on the front end before we got to COVID. And now COVID is putting such a pressure on our school districts that the need for extra dollars is going to be necessary in order to assist them, assist our children and their teachers and their families deal with this reality. What I understand, and we run for, this is year number 8 for what has historically been a relatively successful program called Read to Succeed, which is a summer reading program. What I understand that our children, even with the appropriate technology at home and the family supports to encourage engagement in that technology, still are not putting an adequate amount of time into virtual learning. And so then you build upon that challenges that too many of our families have to deal with, and it's becoming very problematic, and falling behind is going to increase dramatically. I think we need to come to grips with understanding that, but then figure out how do we propel an agenda to try to rush our children forward as we start really truly engaging in this. We got to be very careful. All of us have to be very careful that if we don't do schooling right when we return to physical locations, those can potentially be super spreader places. Okay, kids, you know, who may be impervious in some respects to COVID-19, but could be carriers. Okay, interacting with teachers, interacting with family members, interacting with other community members, just all coming to a location that already was challenged physically on the front end, and is even going to be more challenged when we get back to that. So we'll be talking to Secretary Rivera, and also I think Reverend McJunkin, it would be a wise conversation to have with Dr. Hite going forward as well, because you know he's on the front line. He's already struggling with a lack of resources, and it's only going to be amplified.
Thank you for that, Senator Hughes. Staying with the questions related to opening of schools or the potential opening of schools, you explained to us earlier some of the ways in which the federal government has stepped in to provide funding for testing and related to micro business grants. Curious to know whether the federal government has made any steps to provide funding to assist our schools, since there's been a strong desire on the federal level for the schools to be open.
Well, they have. You really want me to go down that rabbit hole? You really?
Yes, sir.
I can't tell you anyone more irresponsible than the person who's occupying 1600 Pennsylvania Avenue. I can't tell you anyone more irresponsible. Or rather 1600 Black Lives Matter Plaza, which is where that building is located. It really is we're going to need, school districts are going to need resources. They're going to need resources. That's why they need to pass as close as possible what Speaker Pelosi pushed through the Congress, and get that passed and get that into law. We need as much of that to become the final document that gets signed into law. It will only happen by public pressure, okay? Only is going to happen by public pressure. Senator Casey is already on board. As I said, we're meeting with him. And again, Reverend McJunkin, I would recommend a conversation with Senator Casey. I know he would not hesitate to be part of a dialogue with this group, because he's our best window and best eyes on it. In Pennsylvania, we also have Senator Toomey, who is following the Trump path. Okay, they need to feel the heat, and I'm told Senator Toomey wants to be governor of Pennsylvania after Governor Wolf is done. Well, here's a way where he can show whether he's committed or not to this community. That's what I'm told. All right. So pressure from the federal government. The document, the piece of work that we need from the federal government is the HEROES Act, which was passed by the Congress, by Speaker Pelosi, and as much of that as possible to become the official law of the land in the next policy. And we need that sooner rather than later. And we cannot buckle down to Trump's calling for schools to open up willy-nilly. We can't buckle down on that. We have to put pressure back on that, because if it's done wrong, the thing that's going to happen is people are going to get sick and they're going to die. They're going to get sick and they're going to die. We can restore an economy, we can fix another school, but that bringing folks back from the dead thing, now I got a bunch of experts who studied up on that stuff. We can't do that.
Thank you.
Just
Thank you,
this-
Senator.
This is Dr. Farley joining. I'm sorry that I joined late. I had trouble getting in on the web.
Hey, Dr. Farley.
How are you doing,
Thank you,
Vincent,
Dr.
Senator?
Farley.
Very good.
And maybe I'll just ask one more question in this moment as Dr. Farley joins us now. Senator, thank you for your passion indeed related to this. It helps us understand the level of support that we have, certainly at the state level. Senator, just one more question from me in this moment, and that is, can you help us understand how it is that the state responds to local municipalities in this during this pandemic, how it is that the state interacts with Philadelphia or with other counties in helping them meet maybe their needs, which might be different in nature?
Well, and Dr. Farley can speak to it from a health department standpoint. I think, if I understand it correctly, the state health department and the city health department talk pretty much, if not once a day, 2 or 3 or 4 times a day, okay? In terms of coordinating and understanding behavior and sharing information and sharing data. The regional counties talk relatively frequently as well, because, as you know, this virus does not know the difference between Philadelphia and Montgomery County or Philadelphia and Delaware County. But the officials understand the differences, and they need to talk, and they have been talking. We facilitated a call with Dr. Farley and the state health department. I guess, Dr. Farley, that was about 3 weeks ago, when the applications were being submitted to Washington for this $90 million and $300 million respectively. And so there is a lot of dialogue. The money that came from Washington to Pennsylvania, a lot of that is spreading out across the state of Pennsylvania, because some of the funds the city of Philadelphia is getting directly. So it's kind of like we got to complement one another. The biggest problem that we're having is that there's a lot of counties in Pennsylvania who are drinking the Trump Kool-Aid, okay? And they are not following the science, they're not following the data, they're not following the information, and they're pushing back. They're blowing back on all of this stuff. So it makes it real difficult. As I said, we had a very compelling presentation yesterday morning from Dr. Rubin, and I know Commissioner Farley knows him from the CHOP Policy Lab. Very compelling presentation. And it was Democrats and Republicans from all across the state on the line. And they heard the information. It was very sobering. It was very clear. And they all agreed with the presentation on the phone. And then they went out in the public and said something else. Okay? So that is the mindset that we're dealing with, okay? And I have to, if you'll excuse me, I have to go into this last piece. Everyone needs to pay attention to, and this is nonpartisan, but everyone needs to pay attention to the Pennsylvania NAACP lawsuit, elections lawsuit that was filed in mid-June. And that is to address the voting procedures for November, because what happened in June in the primary election was not good at all and disenfranchised a lot of people. Everyone needs to pay attention to that. And we're having a presentation from the Pennsylvania NAACP on Zoom this Saturday morning at 10:30. So if anyone is more than welcome to participate, Robin will get the information out to everybody so we can get updated about that. Because if we're not vigilant, if we're not engaged, then what will happen is there will be chaos on election day. There will be chaos on election day. And I'm not advocating one person or another, nor one party or another, but we cannot have a situation where on election day, it's a repeat of 2000 and Bush versus Gore. And some folks need to go back in their mindset and remember the debacle that occurred there. We're set up, if we don't make changes, we're set up to repeat that and possibly even be worse than what occurred in 2000. So we'll make sure you have the information about Saturday's conversation. And we want to make sure that everybody pays close attention to the Pennsylvania NAACP elections lawsuit. It's very important to everything that we're talking about. So I could go on forever, but you got a health commissioner.
Yeah, I'm going to interrupt here and ask the health commissioner if he would please join in now at this time.
Okay, thank you very much. And again, I apologize for calling in late and apologize for being on the phone rather than on the computer. I just had trouble getting in. I did put together a slide presentation, which I can't show because I'm on the phone, but I can at least describe some of the key things that are in there. And what I want to do is give people just a sense of where we've been in the epidemic and where we're going and what our strategy is for where we're going. So first, where we've been, the epidemic peaked in mid-April when we were diagnosing 500 to 600 people a day with this infection. And that was bad. And that got to the point where our hospitals were very close to being full. We didn't have a crisis in our hospitals, but we were dangerously close. Since then, we've made a lot of progress. We got down to about 100 cases a day, and we're testing many more people now than we were testing in April. So that is part of the number of people we're seeing is that we're testing more folks. So that's good that we've made that much progress. So we're definitely much lower rates of infection than we were at the peak of this. However, the trend right now is unfortunately in the wrong direction. Cases are rising across most of the country, throughout the South and the West, in Western Pennsylvania and Delaware, very close by. And so I do believe that our long-term trajectory is probably to get worse. We're probably going to be getting more cases. And it's probably going to be a while like that. So we're going to have to live with the situation of sort of constant presence of the virus, constant risk of the virus. And we're going to be in that situation to one degree or another, I believe, until we can deploy a vaccine. I'm optimistic that we can have the vaccine sometime in 2021, but probably not before then. So we're going to have to deal with that. And our strategy for dealing with that has three components to it. One of them that I call containment, and that is where we test as many people as possible. And then when we identify somebody who has the infection, then we talk to them to find out who they may have been nearby. And those ones we call their contacts. And then we talk to their contacts and try to have them stay in quarantine so that they don't spread the infection further. So we try to cut off that chain of transmission. That whole process is called contact tracing. And we're very much implementing that right now. That's containment. Then the second part of the strategy is social distancing. Those are all the restrictions we have on what businesses can operate and what can't operate, and the requirement that people wear masks and the limitations on gatherings, indoor gatherings and outdoor gatherings. All that we are trying to keep the economy moving while at the same time trying to keep the virus at bay, and it's not an easy balance. So you know, right now in the city of Philadelphia, we're not allowing restaurants to have dining indoors. Bars can't be open indoors. Clearly, restaurants and bars have been major areas of spread in other places. I think that that's one of the reasons why we don't have more cases than we do now, that we're not allowing indoor dining. We are allowing outdoor dining. We are allowing other activities. And so, depending on where the virus goes, we may open things up more, or we may shut things down more. And that's that overall social distancing strategy, because we know that the testing and contact tracing by itself is not going to contain this. So we're going to need to have some of that social distancing again until I think we ultimately have a vaccine. The third element of strategy is what I call protecting vulnerable populations. That fortunately, most people who get this infection recover. Many people don't even know it. It's such a mild infection, but a very small fraction of people have very, very serious infections, and obviously people die from this. So if we can identify the people who are the most vulnerable and protect them, then even if other people get the infection, we haven't done any serious damage. The most vulnerable people are people in nursing homes, so we're working a lot with nursing homes to try to protect them from a second wave. But there are also vulnerable people living at home, people receiving home health care, somebody 75, 80 years old who's got heart condition, they're very vulnerable. We're trying to make sure they can stay at home and the virus doesn't come into their home and infect them. And we can't control it across the city, but we can try to provide some guidance to people to help limit that from happening. So those three are the three elements of our strategy. We're going to continue to adjust those and strengthen those as much as we can through this, but it's going to be, unfortunately, a long slog until we have the vaccine. So that's the broad picture of where we were, where we're going, and I'd be happy to answer any questions.
Let's start with Luis.
Okay. Thank you. Thank you, James. It's a privilege to be on this distinguished panel. Senator Hughes, Commissioner Farley, Reverends Dr. Good, and Maria Lewis. I was tasked to ask each of our presenters a question from the perspective of a community of color, and from a perspective from the community that, though rarely mentioned in press and other areas, is the communities of color that have been hurt the most by this virus, both in terms of death and also percentage of people dying, and also the fact that we are the essential workers being people that are paid under $15 an hour and are forced to go to work. Senator Hughes, thank you for all the work you've already done. What challenges do you have that would allow for us as we move forward to find funding to come directly to the minority faith and to minority community-based organizations, as opposed to funding that normally goes to the political structure and sometimes becomes difficult for neighborhoods and for the faith community to get at? How can faith-based and community-based organizations help you, Senator, to get the support to the grassroots?
Thank you, Reverend Cortez, and always all blessings with you, sir. Always all blessings.
Thank you.
So I think the key thing, if we think in areas, right? So we got the small business thing going. We've got, today we just announced a $50 million fund for hazard pay for frontline workers. And that's a good thing. We're gonna need to get that word out to individuals that they can apply principally through their place of work for this hazard pay, which could provide, I think, about $1,200 to these individuals, and this is for back work that was done. We announced a week ago $175 million for protection against evictions if you're a renter, and foreclosures if you're a homeowner. That's about a $175 million program. And we still have, in Harrisburg, we still have some additional funds that can be spent in areas like this. And I believe that hopefully we'll be making a decision sooner rather than later on how those dollars should be spent. I would submit in probably the largest category which Dr. Farley talked about, and I'd love him to confirm or piggyback on what it is that I'm saying, that the largest category for potentially wiping this virus out is in the testing and contact tracing space, okay? As I said earlier, we need medical professionals to do the actual testing, right? And the city is doing, the one that has the greatest level of diversity that we all, I think, refer to as the Black Doctors COVID Testing Consortium. The city is doing some work with them. I believe the state will be doing some work with them as also. But other similarly situated entities can establish themselves as well and come together with a proven track record of delivery and get engaged in that. I quite frankly think that, as Dr. Farley has said earlier, that this disease is going to be with us for quite some time. And the ability to really get our handle on it, I think, is in testing and contact tracing, okay? And I believe that those positions should be people who need to get paid and do it as a job. And I believe that I believe that it's a certain individual that can best communicate with someone around the very hard questions that need to be answered about contact tracing. Where were you? Who were you with? You don't have to tell me what you were doing, but were you socially distant? Okay, y'all are smart people. You can figure out where I'm going with this, all right? You know, and not everybody can get a truthful answer. Clergy can, because you're trusted, and you have a special role in that. And I think organizing yourself to that end helps deal with how to solve the problem. It is, but I have to say this, and I'll hand it over to Commissioner Farley. This is a resource conversation. The state is in huge deficit. The city is in huge deficit. The federal government has the money. And we need to be about advocating for fully funding that program that came out of the House of Representatives and Speaker Pelosi, the HEROES Act. Everybody's got to speak out on that, because that's where the new dollars can come in to fortify Dr. Farley's efforts, to fortify the state's efforts, and to empower you all to do some real serious work in our community. Dr. Farley, am I on point on that, Dr. Farley?
You couldn't possibly be more on point on that. So, you know, we've been dealing with the school system here in Philadelphia, and they, at a minimum, have additional $80 million worth of expenditures just to do the plan that they're talking about now, and where they would like to do more than that. And they don't have that $80 million. And so the HEROES Act could provide the funding that they need, so that there are, you know, targeted grants that we have received for things like testing, but the overall city budget, the overall state budget has collapsed because of the tax revenue has gone down. And the federal government has the ability to fill that in so that we don't have to cut all these services, and that we can actually provide anything other than those specific targeted areas, those kind of things done. And so, yes, the HEROES Act is extremely important.
Commissioner Farley, we also want to thank you for the work you've been doing over the last few months since the virus, prior to the virus, but especially the charge that you've had since the virus has shown up and taken over our lives. In the beginning and through much of the first few months, one of the issues we've had with the Hispanic community has been communications. For a long time, it was our community newspaper, Impacto, and their digital media that was translating for the city into Spanish. How can your office establish communications directly with the Latino community? And how can your office assure that when tracers are funded, that they will actually be hired from within the local community as opposed to not, and that the language issue will be addressed?
Yeah, so a really important point. Yeah, people speak many different languages in Philadelphia, Spanish being by far the most common, but not the only one, besides English. So, you know, our press conferences now, we do translation in Spanish in all of them so that people They don't have to wait even for something in writing. They can just hear it at the press conference. When we do our educational campaigns, we're always translating them into Spanish, often in other languages as well. And we are, when we do we have our mask campaign right now, a media campaign encouraging people to wear masks. We are purchasing ads in community newspapers. We're not purchasing ads, by the way, in the Inquirer. It's all in community newspapers, and so I hope it's in the newspapers. You're talking about the Spanish-speaking newspapers. We certainly have a Spanish-language campaigns. On the contact tracing, I also feel very strongly that the people who are doing contact tracing should be reflective of the community that they're serving. So we're staffing up now. We have a very diverse staff. Approximately 50% of our staff we're hiring are African American. Approximately 10% are Latino. We have one entire team. They're broken up into 5 teams. One entire team is our Spanish-speaking team, so that everyone on that team is going to be dealing with the Spanish-speaking folks that they're dealing with. So we're going to have to. So we definitely are working on that. If there's ways which you feel like we're not being sensitive to the needs of Spanish-speaking folks, let me know, because we think that's important. You know, everybody has heard that disinfection rates are higher in African Americans than they are in whites, but there has been less publicity about the fact that they're also higher in Latinos. And so we want people to be aware that we want to get our messages there as well. So tell us if there's things that we're not already doing that we should be doing in that area.
Super. Thank you. Thank you both for your responses.
Many years ago, when I moved to Philadelphia, Mayor Good was in office, and I spent a number of years working with him and his staff around the issue of homelessness. It was a big part of, that was back when homelessness was getting started, and we were trying to understand what the phenomenon was, and dared to believe that we would be able to work to end that phenomenon. And we used to call it the spigot, the employment issues that contributed to families continuing to fall through the cracks. And Mayor Good, Reverend Dr. Good, is still working with that population now. So we asked him if he would ask questions of Vincent Hughes and Thomas Farley around folks living in congregate care institutions, inclusive of like prisons and homeless and senior citizens, et cetera. So Wilson Good, would you please share?
Thank you so very much for this opportunity, and Senator Hughes and Commissioner Farley, thank both of you for making yourself available to us. I've always been concerned about those persons who are the most vulnerable in any situation. And I think that what we have discovered during this pandemic is that those who are homeless, those who are living on the street, those who are in nursing home, especially those in nursing home in low-income areas, and especially those in nursing homes that are in African-American communities, those who are seniors, those who are in prison, and those people who don't have any other choice but to live next to one another and be next to one another in terms of where they are. So I would ask both Senator Hughes and Commissioner Farley and Senator Hughes, if you would go first, and Commissioner Farley, I would like to ask whether or not there are any special policy, any special legislation, anything going on that will make those who live in nursing homes and those who are in shelters and those in prisons and those less vulnerable to disease like the one that we've had. I know that a large percentage of those who died early on were from nursing homes. I know that those who are outdoors sleeping on streets are exposed. And I know that those who are in prisons without the protection of social distancing also have issues. So I just like to know whether or not, Senator, you've thought about this and whether or not there's anything going on special, because I think we need something special. Mm-hmm. And the same question to you, Commissioner Farley.
Thanks, Mr. Mayor. And your history is accurate, and you've been the conscious of this conversation, this set of issues for decades. I mentioned earlier a state appropriation of federal money, federal CARES money of $175 million to go to assisting renters and homeowners on the issues of prevention and on the issues of eviction, preventing eviction and preventing foreclosure on their mortgages. We also took so that application process started on July 6th. I know the city has a similar program. We've tried to complement the city's program so we're not duplicating it. And so that in addition to the fact that we've been very vocal about making sure that the courts continue the moratorium on evictions and foreclosures. That's extremely important. Reverend Junkin mentioned the spigot earlier. You want to stop it from continuing, because if you evict somebody, you're likely throwing them into a homeless situation. Okay. On the prison situation at the state level, we work very closely with our state prison secretary, John Wetzel, who's considered one of the best in the country in terms of trying to manage the COVID situation in our state facilities. As you can imagine, it's been a very complicated matter. I don't want to speak out of turn, but I think there's some level of control on that in terms of making sure that folks who are in our facilities are not overly exposed and consequently get sicker. And that's also the individuals who work in those facilities as well. And that we're thoughtful about when someone is released. There's been conversations about, releasing folks early, but making sure that we're very thoughtful about what we release folks to. Where are we releasing folks to? And is there situations set when they're released? I'm confident in the capacity at the city level and the state level of having the right mindset in terms of providing the right services, Mr. Mayor. I think the state remains extremely challenged on the money.
I just break in a minute, and I want to make sure that when Commissioner Farley comes on, that he answered this question. I want you to spend a minute on it, and that is, my concern is, especially in the nursing homes,
yep.
That's a profit-making operation for the most part for many of the nursing homes around, and my older brother is in the nursing home, so it's personal to me, and my next oldest brother was in the nursing home before he died, so I know nursing homes. It seems to me that something needs to be done about the professionalism of the nursing home, the amount of dollars that's spent on staffing in nursing home. And I guess I was asking whether or not there's any policy changes anticipated at the state level and the city level, given the exposure that happened to those in nursing home when the pandemic first started.
So I'll speak briefly, and then I'll let the commissioner go forward. you know, we've obviously the nursing homes were, that was it, right? That was where the pandemic just skyrocketed. And unfortunately, as you know, Mr. Mayor, the nursing homes were already precarious on the front end before the pandemic hit, all right? The level of staffing, the level of professional support. The state has gone on intensely, provided about $700 million of new money from the CARES money towards our nursing home community, and not just nursing homes, older adult residences, okay? As you know, we have a lot of facilities in our communities that are not nursing homes, but they're inhabited by lots of seniors and older adults and don't necessarily get the level of services. So we've driven about $700 million in that space. We got to look at the policy stuff, but we can't separate out the financial needs there to get the help that's going on there. Commissioner Farley may be able to better give a bird's eye view on what he's seeing from his.
Thank you, Senator. Right.
Thank you, Mayor.
Yes, first, Mayor, I couldn't agree more. The nursing homes really were ground zero for this epidemic. More than half of the deaths that occurred happened in nursing home residents. In many cases, there were many deaths in individual nursing homes. We tried to help, but we didn't have the resources for all the nursing homes in the city. And the nursing homes are, as you know, they tend to be thinly staffed, not terribly well trained, and there's not a lot of resources. They just were not able to handle this. So I think the best thing that has happened is that the state, and maybe Senator Hughes can tell me exactly what was the mechanism that did this, but the state has now provided funding to hospitals in the city to provide support to nursing homes and other congregate facilities, but nursing homes being the most important. Because the hospitals have infection control experts, and they've got the ability to get testing done, and they've got PPE, and they've got just a whole level of staffing and expertise that nursing homes don't have. And where individual hospitals were supporting nursing homes, we saw that they tended to do much better. So now these hospitals have been funded to provide support on a much broader level. And so I can't guarantee you that when and if we have a second wave, we won't be hitting nursing homes as hard, but I feel like at least we're in better shape now with that kind of support than we were before. I do think this is the, it's the worst setting that there is as far as this infection, because you have a lot of people that are close together, and they are particularly vulnerable. So yes, that's where we ought to be talking more about that. Let me just say, as far as the other settings, in the city jail, we actually did fairly well. The jail did have infection, and a number of inmates did get infected, but it was a relatively small percentage, ended up being about 5%. And with some procedures to prevent spread within the facility. And they also worked to try to release people that didn't need to be there. And those two together, I think, did limit the damage in the jail. Right now, we're in pretty good shape in both the nursing homes and in the jail. Very few cases, and it's not eliminated, but it's very much under control. I do worry about a second wave in both those facilities, but I think we are in better shape than we were in the first wave.
And the homeless.
Mr. Mayor, if I could just get an answer to your question, but by asking Commissioner Farley. So I think one of the big issues, this is my observation, Commissioner Farley, one of the big issues in the front end of this pandemic was a lot of the workers were not appropriately trained, nor did they have the appropriate resources, the equipment, the PPP, and everything like the PPE, excuse me, and everything like that. And it became a big struggle to protect patients and the workers, okay? I don't sense, 4 months into this, I don't sense that the need for PPE and other stuff is as intense as it was before. So consequently, the workers, the frontline workers, who are also in many respects, Commissioner Farley and Mr. Mayor and everybody, these are also individuals who go out to various houses and communities to provide home health care services. I don't think that the challenge is as intense as it was before with respect to appropriate equipment and what have you. Commissioner, I don't know if I'm hitting on the right note there or what.
You are right. Yeah, when the epidemic hit at its worst, there was a real shortage of personal protective equipment all around, and the nursing homes didn't have the ability to find it in ways that hospitals did, and then the staffing didn't know much how to use it, and so there wasn't the kind of vigilance in getting everybody to use equipment that was there all the time. And when you have those breaks in techniques, that's when the virus spread, so that the workers themselves were also at high risk. We had workers who died, as well as residents. So it was bad on the first wave. We're not in a great situation now, but we are far better. There's much more availability of PPE. They've all been trained now, so their training is better than it was before, and they're much more aware of what procedures are important to do in order to protect themselves and their residents. So I expect we'll have problems in nursing homes in the future, but I'm hopeful that this won't be nearly as bad as it was.
Just my last question, very quick to Senator Hughes and to the commissioner, and that is, as a result of what you've seen, what policy change and what change that you would see that need to be made in the areas of those people who are in congregate care in nursing home, prison, and homeless? Is there anything that you could recommend very quickly that would that you see that needs to be done and that you believe should be done?
Funding.
Question to the commissioner.
Funding, Mr. Mayor. Funding. Money.
No policy.
Money. I'm sorry, Mr. Mayor. And I chair the Appropriations Committee, so I always seem to look at things through the lens of funds, okay? But I think, especially with what we've learned from the problems that occurred in the first month and a half or so of this pandemic and how folks have changed, it is very much a resource conversation to get these facilities in the condition that they can be in, and their workers in the condition that they can be in, so that they can have everything in place. This is a money thing. This is a money thing.
Thank you.
So if I could add, I do think it is a money thing. And I'm thinking a little bit off the top of my head, but the one policy change I think may be really important, even though I don't fully know the current policy situation, is you certainly want these workers to have a liberal sick leave policy, so that people don't feel compelled to work when they have symptoms. That's the worst thing you can possibly do, is have someone who knows they're sick and they have to go to the workplace because otherwise they're not going to get paid, and then they spread the infection on to everybody else. And I don't know whether all the people who work in nursing homes and these other facilities get paid sick leave.
And that applies to prison guards and to those who work in homeless shelters as well.
Yes.
Yes.
I want to interject for just a second.
Not having a paid sick leave program across the state, not having a statewide paid sick leave program, so that workers are not challenged with, I don't feel well, I'm likely infected, but I got to go to work because I need that money, and I'm only being paid $10 an hour or $11 an hour or $9 an hour. Mr. Mayor, if we've not seen anything with these essential workers, whether they be in food service, whether they be in healthcare, anything like that, a policy around paid sick leave would be huge right now. Food service, everybody.
Thank you both.
All right, thank you. I want to get a question in, and then I'm going to turn it over to Maria to ask the question that the participants had for Commissioner Farley, and then we're going to wrap it up. We have a number of Asian congregations in Philadelphia Baptist Association, some of whom I see represented here on the call, and I'm concerned about harassment that community has gone through. I have concern. I know one of the churches is doing extraordinary work trying to raise money because a number of the members of their congregation who own businesses or work for businesses that have been shut down, they have a lot of employment issues, and so they're trying to do extraordinary work to raise money to help people who were just left out. And connecting to those kind of resources, I'm sure, would be an issue. And then lastly, we have congregations who are part of the refugee community, and we know that under the current administration, the resources for refugee communities continue to dwindle and be cut drastically. And I've had conversation with congregations who are really struggling, trying to get their members connected to resources. So anywhere in there, Commissioner Farley, what's going on from your perspective?
You know, there's a lot of people who are out a lot of money with this epidemic, businessmen and women who run all sorts of businesses that have been shut down, and then with the ripple effect, other people as well. And the city has some programs to help, but they're, to be honest, not nearly adequate. And so I wish I could say, yeah, there's a great program where they can all get funds, but there aren't the needs. And so this gets back to Senator Hughes' point. The federal government does have the ability to bail out these businesses that have been forced to shut down because of actions of people like me that try to control the epidemic. We want them that money to be available because I wish I could say that we have programs to support the people, but we don't have adequate programs for them.
Reverend Lewis.
Yes, thank you, Dr. McJunkin, and thank you, Commissioner, for taking time with us this evening. I have a number of questions, but I'll try to ask a couple of them.
May I say one thing? Commissioner
Sure.
Farley, you're doing a wonderful job. I've supervised health commissioner for 12 years, and you're doing a wonderful job.
All right. Thank you very much. I appreciate you saying that.
You should take that as a compliment, Commissioner Farley, because he didn't say I'm doing a wonderful job, but you should take that as a compliment. All right? And I'm his personal senator, all right? But that's okay. I'm not upset. I'm not feeling some kind of way, Mr. Mayor. All right?
Well, we definitely
thank you.
We thank the both of you. Commissioners, just a couple maybe I can get in these remaining moments. Our churches are very much understanding of faith, yet understanding science and health as well. It's not mysterious to us, although it may be to some. And we want to adhere to the CDC and state guidelines. At the same time, some of our churches are considering how to do things in a safe manner. Some proposals from churches have been to have social distancing services maybe in the parking lot outside while the weather is still good. I guess we would ask, do you have any particular guidance on how we might be able to do something like that as a church? And then if you know of any resources that the churches can utilize to help individual churches make decisions on how to safely open in social distance.
Yeah. Thanks for a question. That's a great question. We have guidelines on our website right now about how to do religious services in a safe manner, and they get into details about how far people need to be from each other and wearing masks and that kind of thing. That's assuming the service is indoors. However, we do think that anything that happens outdoors is inherently going to be a lower risk activity than what's happening indoors. And so for congregations that think they can do this, I would encourage them to try to have their services outdoors. There's more space for people to spread out. There is less likely this virus to go from one person to another outdoors. You know, it can be kind of hot right now, but if you can find a place to do it and the weather is good, that may be a safe way to have people out there and to participate. We don't have any specific guidelines for religious services outdoors, but I think you can take the guidelines for religious services indoors and apply them outdoors, and it's going to be even safer. And that's a good thing to do. I don't know if any other churches have done this in the city. My guess is that some of them have, and if they have any guidance, I wish I could give you more resources on how to do this, but I'm afraid I don't.
No, thank you for that, Commissioner. And I'm going to try to put a couple of questions together here as one, and that's help us understand some of the testing that's being done.
Sure.
Are there different COVID tests, and is one better than another? And then with regard to antibody testing, is that available for everyone? And how does one get that type of testing?
Yeah, so to keep it simple, there's basically two types of tests that we're talking about. One of them is the main test that you hear about that indicates that you're infected with the virus. That's called a PCR test. You don't need to worry about what those PCR means, but that actually measures the virus presence in your nose. It tells you whether you're infected right now. When you get better, it may linger and still be positive for a couple of weeks, and then it turns negative. The other test is an antibody test. That's a blood test, so they need to stick a needle in your arm, take out your blood, and that measures whether your body has built up an immunity to the virus. So that measures whether you were infected sometime in the past. And it probably indicates that you're, at least for a few months and maybe forever, you're protected against getting another infection. So there aren't too many people that are doing antibody tests because there isn't something you're going to do with that information. I would not, if somebody had an antibody test, I wouldn't say, okay, now great, you don't need to wear a mask, because we're not really sure how long that protection will last. The antibody tests are available in a few of the urgent care centers, but otherwise they're not generally available because we don't really, not recommending them at the moment, and we don't quite know what to do with the results. Now that may change in the future as we learn more about it. But at the moment, we're not generally recommending antibody tests. We are recommending the PCR test for anybody who has respiratory symptoms or a fever, or somebody who's been exposed to somebody else with that, so that we can find out if they're infected and do that contact tracing to try to prevent the chain of spread.
Thank you, Commissioner. And we're getting close to the hour, so Dr. McJunkin, I will turn it back over to you.
Thank you very much. This conversation has been recorded, so if you'd like to have a copy of it, that can be provided for you. You can contact me at the Baptist Association. There's also, if you go on our website, we have some resource information, which also includes recent reports from various agencies. And also contact information so that you can do the work of advocacy with civic leaders. We were provided this information from Senator Hughes' office, and so we put it on our website. And you can use it, and it will connect you around the country to various leaders. I think we've heard some things about policy today that we need to work on. We clearly have heard that we need to help push for the HEROES Act to go through, because the help that we need in our community needs to be funded. So advocacy is what brought us together. What is it that we can do? We can help to try to put some pressure in proper places so that the legislation goes through and we can get the kind of help that we need. Again, I want to thank Senator Hughes and Commissioner Farley, and everybody that's on the call, everybody that helped to make it happen, to Robin Maddox, who really worked hard to help me to stay focused on what it is that we need to do. I want to give a special word of appreciation to her, and to all the clergy and people I see from various communities. It's just wonderful that you're here. So with that said, we're going to bid you a good evening and say thank you very much for all that you have done and all that you will do to be a part of this struggle as we work through this together.
Reverend Junkin,
yes.
Reverend Junkin, I posted in the chat a link for how to answer questions on how religious institutions can get PPP and EIDL funds. There's a link in the chat, and it's my understanding, because we saw that report the other day that the Catholic Church got a whole bunch of dough. Okay, it's my understanding that there remains probably close to $100 billion of PPP money that has not been drawn down yet. And we don't need to let that money just sit there. It was appropriated. We need to go and get it. And so folks should pull up that link and their questions specifically for Reverend Junkin, religious institutions and how they can access those dollars.
That's very helpful. We much appreciate that.
Yes.
Okay. And on that note, we're going to say good night.
Bye-bye.
Bye-bye,
Thank you all for the opportunity. Appreciate it.
Thank you all.
Did I do okay?
Good night.
Did a good job, Senator.
Thank you very much.